My name is Dr. Stuart Armstrong, and I'm talking to you today about meniscal tears of this knee. If you're watching this video today, then you're probably either have a meniscal tear of the knee or are wondering what a meniscal tear is and what you should and shouldn't do about it. So it's one of the most common knee injuries that we will see. And if we look at this model here, the body has two meniscuses in the knee joint. You've got one on the outside of the knee here, and it says floating semicircular cartilage. And then you've got one on the inside of the knee here. And they're there basically to spread the load across the knees. Every time that you take a step, the meniscus spreads the load across, and it's to decrease the wear that you get on the hard cartilage inside the knee. The hard cartilage is the joint surface, and that's that pearly joint surface, nice, white, smooth, and that gives you minimum friction when you're moving the knee joint or any joint in the body that moves. So meniscal tears of the knee, there's two main types of meniscal tears. You get degenerative tears, and that's where you've got damage to the hard cartilage that leads to general wear and tear, and slowly you get little bits of damage in the meniscus that slowly build up over time and give you what we call degenerative meniscal tears. And then you get the acute tear, and that's generally when you're running, you plant the foot, you twist it, and the meniscus gets caught between those two bones, gets caught in between those two bones, and you get a tear in that meniscus, and that tends to be that acute meniscal tear. Initially, after a meniscal tear, you normally get some pain, so it's normally quite painful, it can swell up, and you can get mechanical symptoms, and that's where we talk about clicking, catching, locking in the knee. The main thing we're looking for is true locking, and that's when you move your knee backwards and forwards and it gets stuck. It gets stuck in that position. You might give it a bit of a wiggle, feel a clunk, and then your knee moves freely again. And those are classic mechanical symptoms in the knee. And I'll talk about it later as to why that's important. But any meniscal tear, the first thing to do is to get that diagnosis. So if you're suspecting a meniscal tear, the only way to know for sure is to get an MRI scan of your knee. And that's the only way to really visualize that meniscus and know exactly what's going on. And there's a few different types of meniscal tear. The main thing that we want to know is whether it's a peripheral meniscal tear, and that's when it's in the outside of the outer third of the meniscus, and that's because that's got good blood supply and that can heal. If you get a tear in the inner third, what we call the free edge, then that's much less likely to heal because there's minimal blood supply there. We also want to know what the tear looks like. Does it look like a degenerative tear where the knee meniscus has just been ground away over time, or is it something like a bucket handle tear? Bucket handle tear classically can give you mechanical symptoms, and that's something that you can treat differently from a degenerative meniscal tear. So assuming you've got a diagnosis of a meniscal tear and it's been confirmed, the first question is, what do we do about it? Initially, if it's early days, so if it's within the first 4 to 6 weeks, the majority of times we don't need to do anything about it. We can give it that time, and sometimes it will settle down, get back to normal without any intervention needed. If it's causing ongoing problems after the 6-week mark, then we're talking about whether we do injections or anything like that. The most important thing is, the thing that makes big difference to meniscal tears is whether we can strengthen up that knee. So if we're able to work on strengthening exercises, build the strength of all the muscles around that knee, it's the best thing we have to stabilize that knee and stop it causing ongoing issues. So that's where it comes down to getting the physiotherapist involved to get you working on strengthening exercises. One of the best strengthening exercises is biking, and it's something I'm a great fan of in my patients with meniscal tears. So I normally get them biking, aiming for 30 to 60 minutes a day on the bike to build up that strength there. Now, if you can't bike because it's too sore, then we need to get rid of the pain. And there's a couple of ways we can do that. The main thing that we look at initially is anti-inflammatory tablets to try and bring down that swelling. And if they're not effective, then that's when we can do a cortisone injection into the knee joint itself. And I'll talk about cortisone in a different video, but it's basically a really strong anti-inflammatory aiming to bring down the swelling, bring down the inflammation so that we can get working away on strengthening exercises. Critically, it's the strengthening that's going to make the biggest difference. Now, the next question everyone has is whether you need to go down the surgical route for a meniscal tear. And it depends on a few different things. So the reason we don't want to rush down the surgical route is that if you have a degenerative meniscal tear, or if there's no mechanical symptoms and you take out part of someone's meniscus, then you can end up with wear and tear in the knee long term. If you've got a bit of wear and tear, you can accelerate that, and if you don't have any wear and tear, then you can develop that. And that's basically arthritis that we're talking about. So if you take out someone's meniscus, then you know that they will get more wear and tear faster and sooner down the line. And that's something we want to try and prevent. On the other hand, if someone has purely mechanical symptoms, if it's the locking, the catching that's causing all the problems, then sometimes that can respond very well to surgery. And the surgeons will go in there and they'll do one of two things. They'll either trim off the damaged area of meniscus to hopefully get things back to a nice smooth edge where the knee can flow smoothly over again, not get caught, or sometimes they can try and repair that meniscus, and that's when they sew that meniscus back together to try and get normal function in that meniscus. If you're looking at surgery, then recovery from surgery depends on what they do in there. If they're just trimming off a damaged bit of meniscus, then 4 to 6 weeks after that, you should be getting back into your normal activities. If it's a meniscal repair, then that's a lot longer. It's more like 8 to 12 weeks to get things back to normal. Other than that, the most important thing is the strengthening. And realistically, if we can get away without surgery and we can just strengthen the knee up, then that's the most important thing that we'll look at, and that's getting on the bike. Other activities that you can do, rowing, cross trainer, all those sorts of things where there's no impact are very good activities. The main things to be careful for and try and avoid are the impact activities. Running, box jumps, all those sorts of things where you're jumping and landing. It puts a lot of force through the knee and tends to flare things up. So assuming we can get rid of the pain, you're working on strengthening up the muscles around the knee, and then if over the next few months you're progressing well, you can get back to your usual activities in the hope that this is settling down quite nicely. I hope that answers all your questions about meniscal tears in the knee. If you do have any other questions, then feel free to leave them in the comments below, and I'll try and answer as best as I can. Thanks.